Hi there. I was just wondering, do people vulnerable to COVID-19 complications get tested when they have mild symptoms, or is there a special criteria in place? And also, what does that criteria look like for children that have existing medical conditions such as diabetes? Thank you.
Thank you so much for that important question. Certainly testing is an important part of flattening the curve, and testing capacity is on track to reach just under 19,000 a day by this month. And certainly I'm going to turn things over to Robin Martin to provide the health aspect, and a reminder for those tuning in late that Robin Martin is the Parliamentary Assistant to Ontario's Minister of Health and well equipped to address that question. Robin?
Thanks very much, and thanks, Kate, for the question. Honestly, children are in some ways have been spared a bit by this virus. Not every child, I must say, but it really has a very minimal impact so far on children, at least in our jurisdiction. Very few children have been infected in a way that has caused any serious health concerns at all. But there obviously are testing guidelines available. There's our self-assessment tool, which is on the website, the COVID website on the ontario.ca/coronavirus website, which you can check. But also there are guidelines about who should visit an assessment center available, or their doctor, for example, and there are a number of possible symptoms of COVID-19, and they seem to be a bit different for elderly people than they are for younger people, but most people will have difficulty breathing, sore throat, runny nose, nasal congestion, sometimes difficulty swallowing, occasionally diarrhea or abdominal pain and nausea or vomiting. And so those are the kind of things we look for. And obviously, anyone who has a compromised health status is more vulnerable to any kind of infection. And so you might want to refer to your own family doctor who will know your health condition or the health condition of a child who say, has diabetes, which I think is the example that you mentioned, to see if that child should be tested if they have any of the symptoms at all. And I would think in most cases, you'd want to err on the side of caution to make sure that the child isn't infected. If you have some suspicions, do reach out to a medical professional to advise you. And our testing guidelines don't prevent any test where a doctor recommends it. So if the doctor at the assessment center or a doctor who is your family doctor recommends the test, then the test will happen. And that's just because we have to defer to the doctor's medical judgment on where a test is necessary. I hope that helps.